Good afternoon, ladies and gentlemen. Welcome to a new edition of Today's Youth. In this edition, we're going to be talking about multiple sclerosis, or MS, which is an inflammatory disease that hits the covers of nerve cells in the brain and spinal cord. We'll know more about MS right after this short break. Multiple sclerosis, MS, also known as disseminated sclerosis, is an inflammatory disease in which the insulating covers of nerve cells in the brain and spinal cord are damaged. This damage disrupts the ability of parts of the nervous system to communicate, resulting in a wide range of signs and symptoms, including physical, mental, and sometimes psychiatric problems. While the cause is not clear, the underlying mechanism is thought to be the destruction by the immune system. Proposed causes of this include genetics and environmental factors such as infections. MS is usually diagnosed based on the presenting signs and symptoms and the results of supporting medical tests. There is no known cure of multiple sclerosis. Treatments attempt to improve function after an attack and prevent new attacks from the disease. That's considered to be the most common autoimmune disorder affecting the central nervous system. Welcome back, and we're glad to be joined today by Peter, Nabil, and Myrna Alam, who are patients of MS. Hello, and thank you for joining us today.
Thanks for you.
I would first like you, Peter, to introduce yourself, and then we will go to more details about the disease.
Okay, this is Peter Nabil. I'm an engineer, and right now I'm a sales engineer, senior manager, who have an MS for a long time ago.
Right, and Myrna?
I'm Myrna Ramses, staff student, 22 years old.
You're still a student, right?
Yeah.
Mm-hmm. And when did the disease started hitting you?
Yeah, discovering from a year ago.
You discovered only from a year ago?
Yeah.
And it was before that?
Yeah,
it was there before that, and you couldn't notice anything, any symptoms or any signs or anything?
There was symptoms, but doctors didn't know that.
Right. What were the symptoms that you couldn't discover or you didn't notice very much at the beginning?
Dizziness.
Dizziness?
Yeah.
So that was the first thing, you felt dizziness?
Yeah, it was grating, every attack.
Right. What about you, Peter? How did the symptoms start?
Really, it was start from about eight years ago.
Mm-hmm.
It was an eye. It was an eye that one eye is working well and the other eye is not working at all.
It was related to the eyesight?
Yeah, eyesight, yeah. And then when I'm going to a doctor of eye doctors, so he began to give me another things and let me go to other ways, not
so
MS.
The doctors couldn't discover it at the very beginning?
No, this is maybe the most probably problems that happen in Egypt, that even the doctors...
MS, they don't discover it easily, right?
Don't discover it easily. The only one that discovered it is neurologist doctors, not any other doctors. It's really rare that the doctors can see the MS from the first
but neurologists can discover it.
Yeah, maybe 99% of neurologists know about the disease.
They know, but you didn't go to a neurologist at the beginning?
No, I'm going to the
You
eye
went
doctors.
to
Yeah,
an
and
eye doctor.
then I began to know about the MS. That's why I had to go to the neurologist, and thanks God it was after a week or something like this. So I know it
He
from the
referred you
beginning.
to a neurologist? Did
Sorry?
he refer? Did the doctor that you went to first
No,
refer you to
I
a
go by
neurologist?
myself. So I just go by myself, and
You just went.
yeah, I just went to a neurologist to see if something in the brain or something like this. And at the beginning, the laboratory told me that it was a cancer in the brain.
Brain cancer.
Really, this was the first
What
shock.
are the main X-rays or analysis that you make to discover the MS?
MRI.
MRI, brain MRI.
Yeah.
So that was the first thing the neurologist asked you to do. MRI, brain MRI.
Yeah.
We have some photos here. Would you like to have any comments on those?
Yeah, this is the myelin system, or the shield that is around the nerve system, the nerves. Simply like a cable, electric cables who have a cross-linked polyethylene or shield around the cable, and the autoimmune, because this MS is autoimmune disease, so always attacks the myelin system like a cable. If the shield is not there, the electricity will not go easily through the cable. That's what happened in our nerves, that the electric doesn't go easily through the nerves, which make a lot of symptoms. It's up on which nerves that have been damaged. So this symptoms may be something that you can see it by your eyes, or something that you not see by your eyes. That you can see by your eyes is somehow like walking problems, speech problems. But
so it hits everyone differently.
Yeah.
It can be related to walking. It can be related to eyesight. Here it was with Myrna. It was related to dizziness, right?
And what dizziness and numbness and bladder problems, vision problems, tingling and balance problems. A lot of symptoms that's always maybe similar to other diseases. That's why MS is difficult to figure it out.
And how is it treated? How are you treated?
For me,
I mean, medications or injections, or what kind of medications?
It's different. For me,
I don't mean that you tell me the names of the
No,
medicines,
I know.
What kind of medications?
يعني most of all injections.
Injections.
No,
most of it
all
are injections.
Yeah.
The budget of the medications is around from 5,000 to 23,000 per month.
Per month?
Per month, yeah. And this is, of course, so
too much.
Too much for a normal person.
And does any medical insurance cover you up to pay for the medications?
The only thing in Egypt who afford
The
insurance,
college medications?
100%.
College insurance for the students.
College insurance. So you're paid now through the college insurance.
Yeah.
What about you? You finished college.
Really, the most problem that all the MSers
are
suffering from it, that after college they don't have any kind of support, even the governmental just support maybe half of the medications. So began to go to the charities to borrow some injection from them, and that's it. Concerning the students, the main problem that all the students don't want to graduate, because if they graduate, they will not get the medication free. So some students stop at the college and they don't want to go graduate. This is the most problem that face MSers.
Right. I have this question for both of you, of course. How did your feelings go from shock at the beginning of knowing the disease to adaptation?
Yeah, at the beginning it was a terrible shock. Knowing that you have a chronic disease, you will live with that. It totally affects lifestyle will go upside down.
But you think you can lead a normal life or not?
Yeah, sure.
You can lead a normal life.
But fatigue almost all the time. have fatigueness.
You feel fatigue all the time.
Yeah.
Mhm.
But I wish people could understand that more. And usually, when you say MS, they didn't know what is MS. It's not.
People are not aware. The community is not aware of the disease,
Yeah.
the MS. Of course, we
Yeah.
would like the community to be more aware of the disease and how to cope with the people with the disease.
Yeah, this
Diagnose. The early diagnosis will be perfect.
Early diagnosis helps a lot,
Yeah.
right?
Yeah.
Perfect. Peter just
Peter was
diagnosed it
diagnosed at the very beginning.
1 week.
Yeah.
1 week after
1 week.
the
Yeah.
So
first.
it was a matter of luck that you went to a neurologist.
that's totally a matter of luck and God's help, of course. Maybe the problem that faces a lot of us, the awareness. That's why we are going through a charity or a society. It's called MS Care.
Right.
We are a volunteer in MS Care that already make a community with each other, all MSers with each others, which we help all the MSers to cope with the disease.
Right.
Because at the beginning, all of us have the shock at the beginning. Oh, we have a chronic disease. We'll not live our lives. But message to all MSers, tomorrow will be help for
Better.
us and better.
Of course.
So-
Are you working, Peter?
Yeah, I'm working.
You're
yeah.
working. So and can you go have a normal life through work? I mean, as an employee, do you have any problems? Are you facing any problems?
Concerning me, no, I don't have any problem. But so others, they have a lot of problems. And
Like what?
Some people or some employers that the managers don't support the MSers. So when they have a fatigue or something like this,
Attack,
and
or
or
when they
attack
have
or
an
something like this, it's really problem to them. And the employee, I don't want to get an employee who didn't support me all the times. So go there, and I will not hire you anymore. This is one of the main
So they
problems.
fire him.
Yeah,
I mean,
fire
you
him,
mean
yeah.
they fire him when they discover that he has MS?
Probably, yeah.
Although you think he can work and have a normal life, no problem.
It depends on how
What
attack,
kind of job?
what kind of job and how attacks, and
What kind of jobs are better for MSers?
office jobs.
Office jobs.
Yeah, because almost the high temperatures and the sun
And
is really
heat
harmful.
Is
to,
not good, but they can work in the office.
Yeah, it's better for them because you know MSers have a not good battery. The human don't have a good battery, so feel more fatigued than others who don't have a hard job. It will be so hard to them to live with.
Right, and how do you deal with MS on daily basis, Myrna?
Taking my medicines, checkups every 2 months. Have a checkup.
You have an MRI every 2 months?
No,
No.
it's only for 1 year.
Only doctor checkup
MRI every year.
every year. But you go to visit your doctor
Yeah.
once every 2 months.
Yeah, sure.
Okay, and what about your studies? How can you cope with studying and examinations?
Study, I postponed the last year. I was in the fourth
Why was
grade.
that? Did you have an attack during the exams?
Yeah. The last attacks, I spent 5 years without knowing that I have MS, which upgrades the attacks. So it affects me really hard the last year. So I postponed the year.
Right. Is there any final cure from MS?
No, it hasn't.
Unfortunately.
No. Worldwide. I mean,
Worldwide,
did you
yeah,
search
of
for
course,
that
yeah.
worldwide?
Yeah.
Yeah, this is worldwide.
What are the challenges, the main challenges, Peter, that you think an MS patient faces?
Really, the understand of others to the MS, because it differs. Some people, no, you don't have anything. You are something like making. You are feeling. You are playing or something. No, you don't have anything. This is the one of the most problem, and the other at the end. And some people think that you are sorry to have this and begin some pity on you, and this is always also make a difficulty to MSers.
What about the challenges that faces your caregivers, your families, your people who are supporting you?
The first thing that I wish people know that it's not infection at all.
It's not an infectious disease.
Yeah, it's not infectious at all.
It's not contagious. It doesn't go from one person to another.
No,
Yes.
no. And have a fatigue. You have a fluctuation. Yeah, a bad fluctuation in mood.
It's not always, you don't have a stable lifestyle,
Yeah,
right?
it's over a second and another. You will fluctuate the mood you have.
And how did you get engaged with the MS Society?
Facebook.
Through Facebook.
Yeah.
So they have a Facebook page and
Yeah.
people can reach them through this.
Which afford terrible support.
Good
for-
support.
Yeah.
This page.
What kind of support does the society give?
Spiritual support.
Spiritual support.
Yeah, gathering, talking, having
What about
experience.
financial support?
Financial support. We don't
No.
have. Yeah.
They don't have any financial support.
Yeah, a little.
Tell us examples of educational events that you witnessed or took place at.
Yeah, we actually last month we were in Cairo Runners. We were
You were in Cairo
making
Runners.
awareness the MS. We give flyers to the runners and making a wheelchair people wheelchair join the runners and take prizes.
How important is education and awareness to MS as a disease in Egypt?
It's really important to have this awareness because every time you know it earlier, you have a better life. So we all our job right now in the society is that we spread the awareness among all people because if the message to all people that every time you have something strange in your body, you have to go to the neurologist and see if it's MS or not. Because if you find it at the beginning, it will have more better life than others.
Would you tell me, does MS has any genetic inheritance?
No, actually not.
It's not a genetic disease.
No.
Maybe 1%. It's a little.
1%.
Yeah.
So, I mean, if there is a history in the family, there is a 1% probability that it would be inherited.
Yeah.
Not an MS, but if the family have any autoimmune disease.
Autoimmune disease.
Yeah, autoimmune disease like rheumatoid, a lot of autoimmune disease that really somehow genetic things.
How about awareness events? Do you organize awareness events through the MS Society?
Yes, we already organize a lot of events with a lot of medication companies that really make a lot of days, conference days with doctors, and which give support and awareness to the MSers. So this is help them a lot and let them have their questions. And another way we have a gathering from about every 1 month to talk about our problems with each other, because no one will feel you or like the MSers will
like
know
the
you.
MSers, right?
Yeah.
Right.
So we always gather and make support to each other. Maybe me and Myrna take like a class in MS Society, how you can give a care and the support and awareness to MSers.
And
a volunteer.
do you organize recreation events or entertaining events to MSers?
Yeah, sure.
Like what?
Conferences.
I know conferences, this is educational, but do you organize anything for entertainment?
Yes,
Yeah.
like already gathering for iftar in Ramadan.
During Ramadan?
Yeah, during Ramadan, and we already help each other and dance and plays and give some prizes to the some while we are playing or something like this.
Right. What about sports?
Really,
Do you think MSers can practice sports?
Yeah.
But little bit.
A little.
Little bit.
Yeah,
Uh-huh.
not all the
What
MSers.
kind of sports?
Uh,
I mean, what kind of sports could be suitable for an MSer?
Walking, swimming.
Walking, swimming.
Yeah.
Away from the heat, and you mean
Yeah.
they cannot take heat a lot.
Yes.
The extreme temperature.
They cannot take extreme temperatures.
Yeah.
Uh-huh. And what about the responsibility of state towards patients? Do you think the government or the Ministry of Health should be doing certain things to MSers?
Yes, you know, governmental have to give more support to MSers because you know MS always get the use from 20 to 40s. So it is the power of the country.
So it usually starts at the age 20 to 40.
From 20 to 40. This is about 95%.
It doesn't hit people
Hit
over
people
40.
for 6 years somehow and over 40, but it's really rare. But
Rare.
the wide range is from 20 to 40s. So you know this is the power of the country, the use and how they give the country. So the government have to support MSers through medications or through give awareness to the doctors themselves, because not, as I told you in the beginning, that not all the doctors have a knowing about MSers and MS.
Right, but what do you think the Ministry of Health can do to support MSers?
Insurance.
Insurance.
Yeah. Cover the medicine.
Cover
The cost of my medicine monthly 7,000.
7,000
8,000.
Egyptian pounds.
Yeah. It's terrible. Thank God that I'm in the college, that I have insurance 100%.
You're
But
on the second year of college?
no, I'm the fourth year.
You're in the fourth year.
Yeah.
So what are your plans for the future? I mean, after you graduate, who's going to support your medications?
I'm thinking of not going out of the college.
She stops the graduation. You know, she don't want to graduate because who will support the 7,000 per month? So you're waiting for the governmental to support you.
And I don't have insurance.
You don't have any other
Any
sort of
insurance, no.
insurance?
If I told any work that I have MS, will not insure me. That's
What about you, Peter? You're working. Who's supporting your medications?
Some relatives.
Some relatives are
Yeah.
supporting your
Yeah,
medications.
this is,
So if someone doesn't have a relative to support,
they go to the
or
charities,
someone he goes to the charity organizations,
charity organization or the Christian or Muslim charities, not,
right?
they always support them.
They support.
Yeah, but
Right.
not all of them. MSers, of course, because these charities will not support the 70,000 or the 80,000 MSer in Egypt. And if they support, they will support in Cairo. There's a lot of MSers in all over Egypt. Maybe they didn't have any kind of support.
How many? What's the percentage of MSers in Egypt?
In Egypt, it's about 70 to 80,000 who knows that they have MS, and we don't know, of course, who don't know that they have MS.
So it happens that it can happen that someone is a patient with MS and he doesn't know.
Yeah, we have in our society we have a lot of people that they have MS for 20 years and they didn't get that it is MS.
What about the symptoms? How do they deal with the symptoms and the attacks?
You know, the symptoms is really similar to another's.
To what? It's similar to what?
Really, if I go to something like an eye. So the attack really disappeared by itself without getting the medication, but after 2 weeks. So really you will have a damage. So they think that...
So if it's not treated, it would damage the outside?
Yeah, outside of the myelin system that we were talking about. So really people have an attack and they cured by itself, but it have a lot of repercussions or something like this
on the health itself.
Yeah.
Of the person.
Yeah, that's right.
Right. What about marriage? Can they get married? Can they have a family life, MS patients?
Yeah, they can.
They can.
Peter is married
I'm
and
already
have
married
a son.
and have a baby.
Right. Okay.
But really, at the beginning, oh no, if I am wheelchaired one day, maybe that's already can happen. Who will support my baby and who will support my wife? So really, it's a really a problem that face all MSers. Maybe right now I'm not wheelchaired, but others was wheelchaired, and they didn't have any kind of support from others.
But if someone is taking the medications and following up with the doctors, and why should he be wheelchaired if he's discovered the disease at an early stage and he's taking all his medications? This could happen?
Yeah, this could happen. Really, it's not predictable at all.
It's not predictable.
Maybe one day you will be wheelchaired. So our faith in God that, okay, tomorrow I'm good, so I will live my life today. I don't know about tomorrow. This is maybe MS a problem, all the time, but faith will give you the power to go your life easily.
Right. What about food? Does it have to do with eating certain types of food, or you just eat anything? I mean, it doesn't have to do with the nutrition part.
No, we have to concern the regime.
You have to eat low-fat diet. Low-fat diet.
No junk food.
No junk food.
No meat.
No meat.
Yeah, no red meat. Or fish is very good.
Fish is very good.
Yeah.
Omega-3.
Yeah,
right?
omega-3 and 6-9. It's really good for the MSers.
Do you think that the new diets that are spreading worldwide, the junk food, does this affect the percentage of people having MS?
No.
Really, they didn't know what's the effect MS. Till today, they don't know what gets the MS to the people. No one knows why MS get into the person. So
you think there are no precautions?
No, there's no precautions at all.
Nothing can be done to avoid having this? Not certain diets, not certain foods, not certain experiences, nothing.
Nothing is predictable. Just if you have MS, don't go and eat things, because every time you eat things, you have a kind of maybe attacks more. That's it.
Right. Just a quick note. How do you think your parents and friends could? What should they do to support you? Just a very final, brief note.
Understand us.
Understand
our fatigue.
Right.
Help us to continue.
Understanding is a very important issue with MS. And Peter, Nabil, Mirna, Alam, many thanks for joining us today.
And thanks for you and Al-TV and today's Youth. Thanks a lot.
Thanks. And dear viewers, with this we wrap up this edition of today's Youth. Many thanks for watching, and stay tuned for more coming up here on Al-TV International.